Everyone, welcome to ResearchMD.com. Another great presentation today. We've been doing a series of lectures on endocrinology. My name is Pramil, Cheriyath. I'm a program director, internal medicine residency, transitional residency, and I'm also a director of research, assistant professor of medicine, two large medical schools. So we've been doing a series of lectures on endocrinology, right? We talked about the posterior pituitary hormones. Now we're talking about the anterior pituitary hormones. Today our topic is growth hormone. Very, very important topic, growth hormone. When we talk about growth hormone, it's important to find out about the structure first, right? What is the structure? Of course, it's a peptide hormone, right? 191 amino acids comprised. It also has some disulfide bridges into it, okay? And if you look at it, it's the chromosome 17q involved, and then its molecular weight is around 22,000 kDa, and it's secreted by somatotroph. So that means kind of happen over here. Now let's look at the hypothalamus and the anterior pituitary, okay? When you take a look at the hypothalamus, what we need to know is it gets stimulated. You got growth hormone releasing hormone. It's also called a somatoliberac. Okay, that hormone coming through the hypophyseal portal vessels over here, and then reach the anterior pituitary, and then you release the growth hormone. Okay, there is also an inhibitory hormone, which is called growth hormone inhibitory hormone, which is like somatostatin, which inhibit the release of the growth hormone. Okay, now let's look at how does it actually work. Now, you got two effects when you have growth hormone. You have direct effect and the indirect effect, okay? When you talk about the direct effect, it doesn't involve IGF-1. When you talk about the indirect effect, that's where the IGF-1 is involved. Everybody know that? Now let's look at the direct effect. What happened? You got growth hormone. There's extracellular and intracellular right here, okay? So growth hormone, you got kind of combined the receptor, and then usually the monomerized form, it becomes dimerized, then activate Janus kinase receptor, or phosphorylation happen. All of this kind of happening in the intracellular over here, and then it binds to the STAT protein, and this whole complex get phosphorylated, and the STAT proteins kind of released from here. They come to the nucleus and started the transcription, the DNA and the RNA process kind of happens. Mainly, the STAT protein is kind of released from this complex, and that activate the transcription. Okay, that is a direct effect. Can affect in the liver, can go to the cartilage, and all the other growth hormone make growth in any part of the body, right? Now, what else? Let's look at the indirect effect is through IGF-1, right? So just go through the liver. IGF-1 is directly stimulate the protein synthesis. Okay, so when you look at the measurement of the growth hormone, it's not, recommended anybody measure the growth hormone. Indirect measurement is that we measure the IGF-1 usually. So when you look at the growth hormone, level is usually like very, very low in the body, okay? The two times it can really go high. When you have like sleep, it can go up to 30 nanogram per ml, and when you do strenuous exercise, can go up to 30. Those are the two. Other times, a lot of times, kind of remains very low. Okay, everybody got that? Now let's look at some of the stimulatory and what inhibit the release of the growth hormone. What are the products? So, if there is growth hormone itself can inhibit the growth hormone release, okay? And then increased free fatty acid can inhibit, glucocorticoid can inhibit, aging process. When you get older, the level is going to go down, and somatostatin. All of this can inhibit the growth hormone. It can inhibit it in the pituitary level. It can also inhibit over here in the hypothalamus in the growth hormone inhibitory hormone level. Okay, now let's look at what are the other things stimulated. Ghrelin, another hormone, it's actually produced in the GI tract when there is hunger in the body. Okay, that increases the growth hormone release. Exercise, we already said, like strenuous exercise goes really high, right? Deep sleep, what happens is the level goes up, and then decrease the blood glucose, estrogen, testosterone, and glucocorticoid deficiency, and all of this growth hormone level will go up. Okay, now let's look at the metabolic effects of the growth hormone. Very, very important. Actually, I have like three main mechanisms of the growth hormone acts. One is the increased rate of protein synthesis. Number two, enhances the fat utilization for energy and decrease carbohydrate utilization. Those are the three main mechanisms. Now let's look at each one kind of separately. So increased rate of protein synthesis, the enhanced amino acid transport for protein synthesis, enhance RNA translation, increase transcription, decrease catabolism of the proteins and amino acids. All of them required for protein synthesis. Everybody know that, right? It enhance the fat utilization by the ketogenic effect, and they decrease the carbohydrate utilization by decreased glucose uptake and decreased glucose production, and increase insulin secretion leads finally to increase insulin resistance. Now, how do we measure? Again, when we talk about, like, always don't measure the growth hormone, okay? First, the indirect measurement, always measure the IGF-1. Now, we have a table right here, and depends upon the age, the IGF-1 levels. What do? 16 to 24, IGF level will be 180 to 780, and 25 to 39, 114 to 492, 40 to 54, 90 to 360, greater than 55, 71 to 290. As we get older, it goes down, right? Just like growth hormone level kind of break. Now, after this, next test is the one you can do, the glucose tolerance test, and you give 75 grams of glucose, wait 2 hours, and then you measure the measurement of growth hormone. It should be less than 1 nanogram per ml in normal situation. Tomorrow we will talk about acromegaly and all the abnormality. Today we're just talking about the normal physiology of growth hormone. Very, very important to know, okay? So I'm going to take a look at the whole whiteboard and just kind of summarize a little bit more. Can everybody see this properly? Number one, it's the 191 amino acid, chromosome 17q, and it's secreted by somatotrophs. You got, hypothalamus, right? Hypothalamus, you got growth hormone, releasing hormone. That kind of comes through hypothalamus-hypophyseal portal system. Come to the anterior pituitary, right? And then it stimulates the release of growth hormone. And growth hormone can affect two ways. Remember, it can be direct through this ligand, and that monomerization become dimerized. They have phosphorylation of Janus kinase receptor, and then STAT protein joins this complex. Finally, STAT protein comes out and goes to the nucleus. This is all happening at the intracellular level, and all the transcription process happen, and the protein synthesis. All this happens over here. Okay. Now, what are the indirect effects? Also very important. IGF-1. They actually in the liver, IGF-1 stimulate IGF-1 production and then increase protein synthesis. Okay. Now, when we talk about like some of the things that inhibit growth hormone release is very important. Even growth hormone itself can inhibit it, and increase fatty acid, glucocorticoids, aging, and somatostatin. All of this can inhibit the growth hormone. Now, what are the things stimulate the growth hormone? We already talked about two things. When you have exercise, right? Level go up to 30 right here. What is the next one up here? Sleep, it can go up. What are the other things? Decrease blood glucose and decrease estrogen, testosterone, glucocorticoid. And all of this can stimulate the growth hormone production in the body. Main mechanism, three things we have to know: increased rate of protein synthesis, we can enhance fat utilization, decrease carbohydrate utilization. Those are the main mechanism of metabolic effects on the growth hormone. And always remember the measurement, you're measuring indirectly IGF-1. That's what we're measuring. Only time you measure the growth hormone is after that you gave the oral glucose tolerance test and measure the growth hormone. Okay, thank you very much for joining us. We'll be back with another presentation. Please subscribe to our channel. Greatly appreciate it, because it takes a lot of effort for a lot of people to make a presentation like this. Thank you so much. Have a blessed day.